Dr. Oyang, thank you so much for being with us today. I think I want to preface this with saying killing the CEO of United Healthcare was wrong. I do not endorse, Michael does not endorse, Alicia does not, Dr. Oyang does not endorse the killing of United Healthcare CEO. And it's crazy we have to say that, but like, this is where we are. As we were speaking in the break, I recently saw the Netflix special that Jamie Foxx did about, he said what had happened was, he explained what happened to him in a comedy special. And in the special, he talks about how he went to an emergency room and that doctor sent him home. And it wasn't until his sister came in, saw him at this house that he wasn't in Atlanta, and she said, put him in the car. That's not my brother. He doesn't look okay. And they drove around hospitals in Atlanta until they went into Piedmont Hospital. And it wasn't until going into that hospital that the doctor in the emergency room in Piedmont Hospital said, your brother is having a brain bleed. And I don't know if we'll be able to get him back on track. We're going to try, but he's having a brain bleed. That's what's happening. That underscores, and that's Jamie Foxx, that underscores, I think, why there's so much outrage online and in real life from people about the healthcare industry, because far too many people have a story like this.
Yes, definitely. Thank you for having me on the show. Again, the gleeful reaction to the murder of this man has been awful. At the same time, it unleashed something very deep and very specific in American psyche, which is their anger and their frustration with the healthcare system, particularly with for-profit insurance companies.
Right, and that is a frustration, as you write in the New York Times, that really then manifests with you as the doctor. You write, it is critical for me as a physician to build trust with my patients by giving them clear answers. But the conversations we're seeing now about healthcare remind me that insurance unknowns don't just compromise the care I can deliver my patients, they also undermine the fragile doctor-patient trust. It's an unsustainable dynamic. Just tell me how that shows up for you as you are trying to administer care.
Yeah, so I'm part of the healthcare system. I see patients in emergency room. Oftentimes, they are extremely sick, life and death situations. And the last thing they should be worrying about is if they could pay for their care. And recently, I had a man, he was very sick, his heart rate was very slow. I needed to admit him to the hospital. And he beckons me closer, and I thought he was going to ask, am I going to be okay? Am I going to live? But instead, he asked me, is my insurance going to pay for all of my care if I get admitted to the hospital? And I didn't know the answer to that. I didn't even know what his health plan was.
You know, Michael, today is my older daughter's birthday, and so I've been thinking a lot about the day that she was born and how it's the most magical day of my life. And I go in and they're like, okay, we need to see your insurance and your credit card. That's going to be $1,000. And I was like, oh, we got to do some business before we go through the miracle of giving birth.
Yeah, I mean, I've had situations in the care of my mom when we've had, an emergency and we go take her and someone's going to, before they even get her into the back, who's going to pay for this? Mm-hmm. What's the insurance? Insurance industry drives, Dr. Oyang, our healthcare industry. That's the bottom line. You can prescribe a course of treatment as a physician, with the patient in front of you, with the diagnosis in front of you. You can prescribe that course of treatment, and some bureaucratic insurance operative is sitting there going, no, we ain't paying for that. We're not paying for that. And so that patient's response to you in the moment that, before you committed to care is an important one and an unfortunate one that patients find themselves having to ask, will my insurance cover this? That's the problem. But is the deeper problem the cost in the first place? Why we're spending so much for a bottle of pills? Why patients are spending so much for basic treatment that any place else on the globe they can get either at a significantly reduced cost or for free? What is the balancing act here in our system that's so out of whack that we find ourselves, doctors like yourself, my sister's a doctor, had to stroke a big check as a neonatal doctor before she even saw one patient in the beginning of January to pay for the insurance before she saw a patient. That's the reality for physicians and patients right now.
Yes, exactly. I agree. I mean, I think healthcare prices are through the roof. They're too high. All of these healthcare clinics and hospitals are merging, which gives them more bargaining power. So yes, I agree, the prices are too high. But I also feel like the insurance industry has made it extremely challenging for doctors like myself to provide the care that patients need.